other continuing education, things outside or beyond that?
Oh yeah, I'm very much interested in truancy. And as a result, I've been involved in a number of the programs that have been sponsored. I've been down and I have met in the past with the Secretary of Education, Dr. Zahorchek. It has been my goal to try to reduce the number of placements that do occur throughout the state by developing forms of intervention that are going to identify problems at the earlier stages rather than have them result in dispositions before courts. When the Department of Education was up here, and that was about 2 years ago, we do have a task force here in Luzerne County. That task force is based over at the Luzerne Intermediate Unit. Mary Jo Shisco, Jane Grogan are really the moving forces behind it. But literally we had involvement from all the different school districts in Luzerne County. And one of our thought processes, along with the Department of Education, is to try to identify these problem areas that do exist earlier in time so they can be addressed as quickly as possible. Just this week, I met with two good friends of mine, Ned Delaney and Mike Kendra. Mike Kendra's from Catholic Social Service. Ned Delaney, as you may know, is a licensed psychologist. It's been, I'm going to say 25 years since I've been a practicing social worker. But when I worked inpatient, outpatient, crisis intervention. When I was on crisis intervention, we were in charge from 4 to midnight and midnight to 8, mental health, drug and alcohol, children and youth, Bureau of the Aging. We were the emergency team. Yes, that meant a lot of times you put Band-Aids on problems until the next day when they could be addressed. But I've had the opportunity to see these problems firsthand. There would be nights when you would have each one of the emergency rooms, what we refer to as going off, which meant that there were patients in those emergency rooms that needed evaluation for mental health purposes. Of course, in those days, we had 5 hospitals that were active. We don't have that today. In those days, we had 2 active psychiatric units in the city of Wilkesboro, one at Mercy, one at General. We also had one at Nanticoke, which was in the state hospital.
So the purpose of your meeting this week was specifically to?
My purpose with meeting with both Mike and Ned was, over the course of time, agencies within our community have become more specialized in the types of treatment that they provide. What I had thought of doing was simply replicating a system from one court to another throughout the county. We have 17 magisterial courts. I'm not sure as to how feasible that is, and this is part of your learning process. So what I thought we could do is, if we could get the list of those agencies and identify their areas of expertise, then what we would have available are referrals that we can make early on in the process so as to intervene and hopefully intervene successfully. I do give parents my home cell phone number, okay? I do get calls periodically and I get told and informed as to how they're doing. I don't have a problem with that. It's my belief you have to invest in kids. They're our future. And I put my behavior where my mouth is. I'm out there, been out there. He will tell you, I've coached 34 years.